everyone. My name is Tawana Cameron. I'll be giving you a speech on how the importance of dental hygiene. Make sure you get the area. These are my cards. Did you get the audience? Okay. All right, dental hygiene is very important, okay, to having a healthy life. All right. When you're doing your dental hygiene, you want to make sure to maintain your good dental hygiene, you must brush your teeth at least twice a day. Make sure you floss. Brushing is just not enough. You have to floss so you can get all the food that remains in your teeth after you brush. Okay, toothbrush can't get everything, so you're going to have to floss. All right. It's also important that you maintain good oral dental hygiene because it can lead to diseases such as gingivitis, such as heart disease, okay, also diabetes. Did you all know that?
No, I did not know
Didn't
that.
know that?
I did.
How many of you brush twice a day?
I
know
brush,
some-
floss, and water pick.
Let me see those
That's-
teeth.
That's good. That's good. You know, and you should brush. You need to make sure that to keep up your dental hygiene that you brush when you wake up in the morning and also after dinner. I know some people may brush in between snacks, which is great. If you have that time and you have the equipment to do that, you should do that.
I got a toothbrush in my room.
Make sure you use it.
I can't tell.
All right, you want to use that because sometimes people don't take care of their dental hygiene, and we see it all the time. I know you've talked to people where you're thinking, wow, especially the soldiers. Soldiers, we've experienced that they get free dental, okay, but they don't utilize it. They don't utilize it. All right, so they're not keeping up their dental hygiene. All right, it could be because they lack the knowledge of the importance and the necessity of oral hygiene. All right, brushing and flossing twice a day at least. You also need to make sure that you change your toothbrush. Okay, adults and children of all ages should change their toothbrushes at least every 3 months. Okay, reason being is because the bristles, okay, on the toothbrush, they become ineffective and inefficient to getting the job done. You've worn it out. All right, some brush a little harder than others. All right, when you brush, you want to do circular motion. Okay, I know they have the nice spin brushes out there. That's great. All right, but don't forget about flossing. You have to make sure that you floss as well. All right. If you don't keep up with your dental hygiene, it could lead to various types of diseases, as I spoke about, which is your gingivitis, you have your heart disease, and diabetes.
You can hate the loneliness too. Nobody want to yakumas.
Regular visits to the dentist.
Yes,
too.
you need to make sure. These are some pictures that I've taken. I wanted you to see that. Okay. Poor dental hygiene.
I know she lonely.
This is active duty soldiers right
That's
here.
nasty.
Right here. Okay. You see that? Tooth decay. Soldier had fillings, but they didn't take care of it. Okay. So eventually they get exposed. Right?
Okay, ma'am.
Ew.
Oh,
Okay. Here's another one. Here's another example.
I know him.
Okay. Here's another example.
Who wants to
Then
kiss that one?
it gets infected. Okay, you start getting infections. So you see that little blister like that they have. I think it's depicted on the other slide. On this particular slide here, okay, you see the calculus build up. That's the little white stuff right here that's gotten in there.
Is that a canine picture?
For real.
Or is that a human
Seriously.
picture?
This is
That
it.
looks
This
like
is
a
an
canine.
actual soldier.
That looks like a
Okay.
dog.
dog.
No, ma'am.
Look at those canines. Are you sure
This is
somebody's
an
fooling
act-
you?
Okay.
This is an actual soldier. Okay,
Yeah,
but this is what can
Well,
happen.
he's probably, he or she is probably
Next
sick.
slide.
This is what can actually happen if you don't take care of your teeth. All right, this person, of course, didn't put that at the top of their regimen in the morning to brush or floss,
Probably in the shower.
or even go to the dentist for that matter. Okay. So you have to make sure that you do that. Not only because of what you've just seen here, but treatments can be costly. Okay? You have treatments such as root canals, bridges, crowns. Those things can be very costly. All right? And it depends on your dental plan. Okay, according to the American Dental Association, root canal can lead you from $1,500 or more. Okay, and that's if you have a good plan. If you don't have a great plan, you may end up spending $4,000 on a root canal. Okay, so you'll have to have a crown, a bridge, and all those other items if you don't take care of your teeth. All right, that's very important to ensure that you do that. Now, I also talked about the different diseases, how it can cause heart disease. Okay. Well, during your treatment, sometimes with all the plaque buildup, that can get down into your bloodstream. Okay, which will in turn cause heart disease for you. Okay, it's very important because it can be fatal. So that's very important that you maintain your dental hygiene and your oral hygiene. All right. Also, okay, not only that, okay, that it's going to be costly for you. Okay, but who wants to walk around, okay, with their mouth like that?
They smell like Bolivians.
Okay, it's not a pretty sight. Okay, so you want to make sure that you maintain. Brush your teeth twice a day. Floss in between, because everything can't be captured when you're doing your brushing. Right? Food is left in the teeth, so you want to make sure that you capture all of that. All right. With that, the proper treatment. Okay. If you don't get the proper treatment, you don't treat your heart disease. Again, like I said, it can be fatal. Okay. Some of the diseases that are out there. Okay. Some of the symptoms that you may see: your gums are swollen. Okay. Red. Right. Those are some signs that you have gum disease. Right. Periodontal. You know, people have an unpleasant smell. Okay. That's what that is due to. Right. They have periodontal disease. Okay. All right. So you want to maintain. You want to take care. Okay, of your teeth, so you don't have that unpleasant smell, and you don't have to be around someone that has that. Okay. So brushing is good. You must brush your teeth at least twice a day. Now, in conclusion of all this, we have discussed the importance of maintaining good dental and oral hygiene. Right? Brush twice a day. Once when you wake up, and then you're going to brush after dinner. If you have the opportunity to brush in between snacks, then you should do so. They have the little, yes.
What if you brush once in the morning and once at night? That's fine.
That's twice a day.
Okay. So it doesn't matter if you do it right after eating?
He can't count. You have to excuse him.
The purpose is to brush after you have dinner.
Right.
Okay, so you can get all of the food and particles out of your teeth.
Oh. I let mine sit there for a little bit.
You like it? Well, you're the exception, right? Remember, you don't want to look like this.
Gross.
Okay, you don't want to look like this. I know it's hard to bear, but this comes from bad dental and oral hygiene right here. Right? So make sure you maintain good dental hygiene.